From education to healthcare, jobs, and justice, our news team is revealing the disparities where they exist, and we're also reporting on possible solutions to these problems.
Take a drive through Houston and you'll find a struggling neighborhood right next to a thriving one, separated only by a major street. That's the case for Houston's Gulfton and Bel Air neighborhoods, especially when it comes to the coronavirus pandemic.
Our first story reveals a big gap in how COVID-19 is affecting two different communities existing side by side.
Gulfton is one of the hardest hit areas in Houston. Channel 2's Roseanne Aragon is there tonight to explain why that neighborhood is suffering so much while Bel Air is faring much better. Roseanne?
That's right. Two neighboring areas, two vastly different qualities of life. We're here in Gulfton, where I spoke with many working families who are struggling to get by, but they love this community and want to work together to make Houston stronger. It's the sights and sounds of everyday people living everyday lives. And here in Gulfton, for Isamar Aragon, that's bread.
Every day we have clients coming in the morning and the evening.
Seeing customers like 70-year-old Jose Hernandez taking his daily bread and coffee break after pushing his soda cart around town.
I come here every day, except Sunday.
His smiling face says it all.
I'm thankful to God for how well I have it.
Because for many of his neighbors, each day is about survival.
Our community, the majority, works in the service industry, and they are out providing you your food, cleaning the hospitals, the hotels, and doing the sanitation. And so they are at very, very high risk of getting infected with COVID. Sandra Rodriguez is a longtime resident and leader. As we talk to our neighbors, we hear what their challenges are. Made up of mostly minorities, 69% Hispanic, Gulfton is rich in culture, but dwindling in economic health. A lot of our families are making minimum wage and sometimes less. Maria Shire is a snapshot.
I'm really worried because jobs are scarce and there's very little money.
COVID has hit Gulfton hard, with more than 1,100 confirmed cases of COVID and 13 reported deaths. But across Bissonnette, one major street to the east, the story is much different in the city of Bel Air. The more affluent town has reported just 78 cases as of Thursday morning.
We've had a number of recoveries and thankfully no deaths.
Two neighboring communities, drastically different qualities of life. A divide so stark you can see it on a life expectancy map.
This is Gulfton, right here, all of this pink, and this is Bel Air.
The Episcopal Health Foundation showed us this census data. Life expectancy in Bel Air is 87.4 years old. In Gulfton, 75.9, more than a decade difference. Gulfton's median household income, $26,000, compared to Bel Air's at $201,000.
What the map really shows you is that geography does matter. If you live in a neighborhood that is very congested, where the quality of housing is not as high as other neighborhoods, where the job opportunities are not as great as in other neighborhoods, and where public safety and perhaps access to affordable fresh food, you simply don't have the opportunities to live a healthy lifestyle.
In Bel Air,
our primary and foremost objective has always been the protection of public health and safety.
Today I got laid off.
This Bel Air resident, whose wife works as a doctor, is confident they should be okay.
I've got an interview tomorrow, so it's a good sign.
But for Gulfton residents like Guillermina, she isn't so sure. Her husband was the breadwinner and worked to clean hospitals. Like Isamar, Jose, and Maria, they didn't have health insurance.
He was really scared because he knew they were bringing sick people into the hospital.
But he had to work. Guillermina, her husband, and her children all got COVID. Her husband went to the hospital in May. He died on June 13th. She never got to see him.
He was such a good person. He took care of my kids.
It's stories like hers that have inspired District J Councilman Edward Pollard and the city to organize regular community food and PPE drives. Likewise, the mayor created a health equity response initiative and task force, accelerating data-driven, targeted, and rapid response that gets food and info to COVID residents in 22 priority super neighborhoods.
Everyone just needs to lead by example.
These residents residents need.
Access to information, access to health care, and access to testing sites.
Is everything being distributed equally? If so, we're not addressing the inequities because everyone doesn't have the same needs.
Because beyond geographical lines are people, families who all want health, happiness, and
Muy positiva, optimista.
a stronger Houston. And we have put together a list of resources for families in need, which you could find at clicktohouston.com. Reporting for A Stronger Houston, I'm Roseanne Aragon, KPRC, Channel 2 News.
Roseanne, thank you. And Gulfton is just one of many Houston area communities with a large Hispanic population, one of the hardest hit demographics during this pandemic. With the disparity on full display, City of Houston leaders are launching a new campaign hoping to slow the spread of the virus, especially within Hispanic communities. Bill Barajas continues our coverage now live downtown with details on this new initiative. Bill?
Well, that new initiative will be known as Better Together. Mayor Sylvester Turner and city officials saying it will be a multilingual, information-based campaign that will stop the spread of the coronavirus, hopefully, and reduce the positivity rate. Now, the campaign will focus on getting out necessary knowledge and information and skills to families impacted the most, families and communities impacted the most by the coronavirus. It will utilize TV, radio, print, and digital ads, as well as include neighborhood canvassing, signage in public locations, toolkits for businesses and organizations, and virtual education sessions. One of the communities targeted in the campaign is the Hispanic community, which is being affected at a higher rate than most. For example, there were 15 COVID-related deaths announced today, and 9 of those were in the Hispanic community.
The city of Houston's Hispanic community is disproportionately impacted, accounting for approximately 40% of cases and 45% of the deaths. And one of the biggest hurdles we face is getting factual, potentially life-saving information into the hands of the people who need that information the most.
The mayor also proclaiming the month of August as Better Together month. He says everyone needs to do their part. Live in downtown, Bill Barajas, KPRC, Channel 2 News.
Bill, thank you. And on the heels of the city's new initiative, we'd like to hear from you at home. If there's a story about inequality in your community, we want to know about it. Just send us an email to storyideas@kprc.com.